This is the best way still to flatten the curve, to spread out the volume of patients over time and lessen the number of patients overall that might need hospital-level care or ICU-level care. It's by doing this, by respecting those social and physical distancing guidelines, that we can make sure that there's not excessive strain on the healthcare and hospital system and preserve those resources for those that need them. When hospital demand does strike, most of the surge capacity, as I've explained previously, still happens within the hospitals themselves. As a snapshot within the Department of Health Services and our 4 hospitals, among our 1,400 beds, we have 600 beds open today. That volume is open because of our work to discharge patients to lower level of care settings, because we have curbed elective surgeries and elective procedures so that we can make sure we have beds available for patients who are COVID positive or suspected to be positive. Simultaneously, we're working to add additional capacity in both medical, surgical, and ICU units, and importantly, making sure that we have the staff that are available to meet the needs of those patients and the supplies that are needed to care for them. Private hospitals across the county are doing the same, and the county's EMS agency is working in partnership with them to help support their needs for supplies and equipment to accommodate that surge. The county is also working on a variety of alternative care sites. These include the Mercy Ship and various quarantine and isolation sites that we are looking to stand up over the weeks to come. We are also very grateful for the support of our state and federal partners to help bring additional critical care and med-surg beds online. The EMS agency within the Department of Health Services continues to manage the flow of personal protective equipment from the state and national stockpiles and is distributing that on a daily basis to hospitals based on their particular needs. This does include ventilators. There are currently 1,000 or so, I think the precise number was 963 ventilators that public and private hospitals reported as being available for a patient's use located within the hospitals themselves. On top of this, the EMS agency has an additional 170 ventilators that are available to be distributed to hospitals based on their particular need. These were recently refurbished by the state, and we're grateful for their partnership in doing this. We have also just sent an additional 150 ventilators up to the state for their assistance in servicing and refurbishing those ventilators, which will help to increase the total available pool that's on hand for hospitals based on need. There are additional orders and supply of ventilators that are in the works on top of this 320. In closing, I want to reassure the public that the LA County hospital system, both public and private, is doing everything it can to be able to scale up and meet the projected demand. But I would reiterate the crucial importance of respecting those physical and social distancing guidelines so that we can flatten the curve and make sure that there's not excessive strain on the hospital system in the days and weeks to come. With that, I'll turn it over for questions.
Ladies and gentlemen, if you would like to ask a question, please press 1, then 0 on your telephone keypad. You may withdraw your question at any time by repeating the 1 and 0 command. If you're using a speakerphone, we ask that you please pick up the handset before pressing the numbers to avoid any echoing. So once again, if you have a question, you may press 1 and then 0 at this time. One moment, please, for our first question. And our first question comes from the line of Jim Roop with Westwood One News. Your line is open, sir.
Hi, thank you very much. Good afternoon, and thank you all very much for your work and your leadership in all of this. 2 clarifications, if you would, please. First of all, clarifying what are you shouldn't do and what you should not do. There's a lot of confusion about what the mandates are and what the common sense stuff is expected to be, such as can your niece come over for supper? Can one couple invite another couple over? That kind of thing. What are the shoulds and what are the actual don'ts on that? And number 2, would it follow that with the testing that's been going on over the past couple of weeks and with the social distancing that's been going on, would it follow that in a couple of weeks or so, that should be where we would start to see possibly a change in the arc, a little downturn? Would it follow that? Is this path, am I logical in this path?
Sure. Both are really good questions. Let me start with your last question. When will we see sort of the fruits of all of our efforts around social distancing and what should we expect. You know, if you look at other countries, what you should expect is that for the next 3 weeks, for sure, we'll continue to see a lot more cases. Part of that here in LA County is because we have a lot more testing available. And with a lot more testing, we're going to be able to find more people who are positive. And part is because we have more positive people who are infecting other people. And we will continue to see an increase. I think as Dr. Galley noticed earlier when she was speaking, what the social distancing does, even while we're increasing the number of cases, is it slows the rate of that increase. In most countries, what you've seen is a steady increase for a few weeks, and then, like in Italy now, you've started to see a decline. It's not like they don't have new cases, but the rate at which they have new cases starts going down. So if you look at your curves, you know, on your maps or something, you'll see you'll peak, and then you'll start having less cases each day until finally you get to a plateau. It won't be a plateau where there are no cases. I think we'll always have more cases for a while, but it won't be at the rate of new cases that we're experiencing right now. So to be realistic, I think everyone needs to be prepared for the next 2 to 3 weeks for seeing a pretty steady increase and even dramatic increase as we improve capacity around testing in the number of new cases, always understanding that if we weren't doing everything we're doing now around social distancing, around quarantining, around isolation, that increase would be much steeper. We'd have many, many, many more cases than even the hundreds and hundreds of cases I report on every day. So even right now, social distancing has an impact, but it will be over a period of weeks before we start coming to the other side and start seeing a decline in the rate of new cases. And in terms of like, what do we mean with our guidance about, you know, stay home and who needs to stay home and what does social distancing really look like? Unfortunately, it means stay home with the people who you live with. So if your household, you know, has 8 people in it, then you all are together and you're one household. But please don't invite other people to come to dinner. Please don't go out to someone else's house for dinner. The whole idea is that you stay in as small a unit as possible in terms of the people that can expose you and the people that you're exposing. And that you limit your contact with everybody else so that if somebody in your household gets sick, that person can isolate, the rest of you can quarantine, and you cannot spread it to anybody else in the rest of the community. So it is important that you stay with your household, don't invite people over for dinner. I know it's really hard to stay with the same people. Use your social media tools and your phones as ways of connecting with other people. But please don't be having exchanges with people who are living in other houses or other households. You just need to contact them remotely at this point. Thank you, and we'll take the next question.
And our next question comes from the line of Tony Barbosa with LA Times. Your line is open. Please go ahead.
Hey, Tony.
Hi. Yeah, this is a question for Barbara. I wanted to know what specifically the county or other authorities are doing to expand testing in low-income communities of color, where we understand local leaders have raised a lot of concerns about lack of access to getting tests, even in the first place. And then, second, I was wondering if you could address whether you are collecting or whether there is data being collected on the race or other demographics of those who are being tested and those who are being confirmed positive. Thank you.
Yeah, thanks, Tony. I think that I can say that for those folks that are confirmed as positive, that we've actually been able to speak to and collect information from, we are trying to get good information about race and ethnicity. We don't often get that from lab reports. So I want to say if you were to look at who is getting tested by race and ethnicity, it would be very incomplete data. We even are struggling for the data to be as complete as we'd like it to be for people who test positive, and that's really dependent on whether or not we're able to get information from medical records and or from interviews. So I want to note that limitation, particularly on all of the people who are tested but are negative, which are still the majority of people being tested. We just don't have that information from the lab reports. I do appreciate your question about equity issues related to testing, and I know I've spoken to you earlier about this, and that we're really trying to dig into sort of access around testing and what do we know about disproportionality, about who's able to get tested and why that's happening. I think Dr. Kazan can talk best to sort of the increased capacity, and our hope is that, we're paying attention to some of the areas where, in fact, we know there has been less testing. San Gabriel Valley, for example, some of the outlying areas up in Lancaster, some of the communities around South LA, where it definitely looks like, based on the data we have, that there are less people that are being tested. Part of that is working with providers as well, so that they understand their obligation to do clinical assessments for folks and recommend people who need to be tested to get that testing. But the other part, as you're noting, is how easy is it to find a place where I can get a specimen taken and then have that specimen sent to the lab. My team is trying to do a more detailed report for you, so hopefully in the next few days we'll be able to break down some of the testing data more accurately so that you could take a harder look at what we think might be happening. But appreciate that question. And we'll go on to the next question.
Our next question comes from the line of Dave Lopez with Channel 2 and 9 News. Your line is open. Please go ahead.
Yes, good afternoon to all of you. Doctor, you partially answered this, but I know this may be an impossible number to reach, but what number would be satisfactory for you and your investigators to be able to tell when we hit the peak? You mentioned 3 weeks. Can you give us a number of how many should be tested? Will there come a point where we can test everybody, or would that be necessary? And one last point, should we be ready to stay in place like we're living now through the month of May and possibly into June?
Wow. I'd be like so happy if I were the person that could answer your questions, because I know, like, we all want to know that, and I can't. What we'll do, the only way we know when we've peaked and then we start going in the other direction is when that actually happens. We do look every day at the rate of acceleration, and I try to report to all of the viewers and listeners and readers on what the doubling looks like. Last week we had tripled, this week we're doubling, so that people can see what the rate of increase is. And we do look at sort of what will be our capacity for testing. My sense is that probably at some point next week we'll be able to do 10,000 tests a day. And if we stay at 10% of people tested are going to be positive, that means that every day we would have 1,000 people who might be positive. So if that rate holds steady, that we can anticipate, that would be the number of cases we would see for a while. And then we just have to watch very carefully what's happening with demand on the hospitals and people really doing their part around social distancing so that we don't see additional peaks that really could be prevented. But I don't have the answers to when that's going to happen. And again, we've got some modeling data, and we're going to try to report back out on that, later this week on what some of the experts are saying when they plug in some of our data about what we might expect and when that peak might happen. So hopefully I answered that, but we'll go on to the next question.
Our next question comes from the line of John Ansack with Associated Press. Your line is open. Please go ahead.
Staying on the topic of testing, we know we're adding capacity to test, but are we also adding capacity to process those tests? How are we doing that? And what is the current backlog of completed tests to be reviewed?
That's a really good question, and that's a question that I've been pretty focused on, because it doesn't really help us as much as it ought to if there are really long waits for people to find out whether they're positive. And that's particularly true right now when we're testing people who are symptomatic. It's really important for us to know if they're positive, both for their medical treatment, but also so that we can immediately move those people into isolation, identify their close contacts, and have their close contacts quarantining. Those are still essential tools. And we need to work hard, particularly with the commercial labs, to make sure that they're increasing their capacity to process the tests. Every week, my team looks at what the average length of time is between the time a specimen arrives at a lab and the time we get a result. And as I reported last week or earlier this week, it was 5 to 6 days on average. That means in some places, particularly I want to give a lot of credit to our hospitals and some of the additional lab capacities that have been built up, that they're doing it in 24 to 48 hours. But in other places, people have told us they're waiting 8, 10, 12 days, and that's what the data shows. So we need to get those numbers down. I think everyone is working their hardest. I want to give a lot of credit to all of the labs for trying to do just what you said. Make sure the processing capacity is equal to the capacity to collect specimens. Next question.
Our next question comes from the line of Melanie Mason with LA Times. Your line is open. Please go ahead.
Hi, Dr. Ferrer. I have a couple questions I'll try and tick through as efficiently as I can. You mentioned the 5 people experiencing homelessness with COVID-19. Are any of them hospitalized, and if so, are any in the ICU? And is that figure separate from the people working in the shelter, as you had mentioned, the case of one positive case yesterday? Secondly, on testing, we were just talking about testing capacity for processing. Can you approximate how many of those 21,000 tests you mentioned are still awaiting results? And is there a point where the delay in processing those tests affects the quality of the samples? And then I have a third question for you about supplies being requested from county hospitals, but it's a little more involved, so I'll throw those to you first.
Okay. So on the testing question, everything that I report is on results. So when I report the number of tests, I'm reporting the number of tests that I have results for, and I'm reporting the total number, which includes the number of people who tested negative and the number of people who tested positive. So none of that information is about pending results, but we do get information from the labs, so we're able to track over time what the length of time is between the time they receive a specimen and the time they send us a result. So I think that takes care of that question in terms of how we're reporting. The first question on people experiencing homelessness, yes, the numbers I reported today are 5 people, individual people who are experiencing homelessness. It's not the staff. There are currently 2 staff that we know of that are providing services at 2 different institutional settings that have also tested positive. Of the folks who are persons experiencing homelessness, of those 5 people that I know about today, none of them have passed. And I don't really know for sure whether anybody is in the hospital. I don't think anybody is in the hospital, but I'd have to confirm that information. Thank you. Next question?
Thank you.
Yeah. You had another question. Yes. Go ahead.
I did. I appreciate it. When it comes to supplies being requested, I know the hospitals are coming to you, to the county, to request supplies, but then you guys are filtering up the chain. Are you able to give us any sense of what supplies and the quantity of the supplies that are being requested and how you guys are moving those requests up the chain, and if the county has received supplies in response to those requests yet?
Yes, we have received supplies from the state and national stockpile. Those are distributed through the EMS agency. There is data on the DHS internet website that provides the sum total and the weekly total of supplies that have been distributed to hospitals and healthcare providers across the county. That's a weekly count by PPE category, for example, by gloves, gowns, N95 masks, surgical masks. The ventilator numbers are not included in there. We've only given out 2 or 3 ventilators to hospitals. The vast majority of hospitals still have sufficient ventilators on hand, so EMS has not needed to distribute those. On that dashboard, what's included online, it does not include the number that was requested. It just includes the number that was distributed. These numbers are changing on a daily basis based on both supplies coming in from the state and national stockpile as well as supplies that are coming in from our own internal county supply chain, and then they're being distributed out based on demand and the size of the facility requesting. Next question.
Our next question comes from the line of Steve Gregory with KFI News. Your line is open. Please go ahead.
Thank you and good afternoon. And this could either be for Dr. Galley or Dr. Ferrer. I'm being told that the county labs, are working 8 hours a day and not weekends. I'm wondering If that is the case, and why are not lab workers working overtime and on weekends to speed up the turnaround time on test results? Also, Dr. Ferrer,
maybe we'll just take that question. So the county public health lab, we're working 18 hours a day and we work 7 days a week. I'm not sure what lab you might be thinking of. Dr. Galley could talk about what's happening with the lab that she has at DHS, but our county lab has been since the very beginning processing 18 hours a day, 7 days a week.
Okay, excellent. Thank you for that. The other question has to do with people that who have been able to recover from COVID-19, but it might still be in their system. Is there any issue or danger with someone still being contagious, even though they've been sort of given a clean bill of health in terms of the illness itself, but it's still being in their system?
I'll let Dr. Ferrer take that question just as a follow-up to your previous question. A variety of DHS facilities have labs. We have started in-house testing at one of our hospitals, with the remaining hospitals coming online soon, and all of our hospital labs are 24/7. But I'll turn the other question over to Dr. Ferrer.
Yeah, can you just repeat the second question you asked?
Follow-up, just so you know, we're not bombarding you on purpose.
Oh, yeah.
The question is, people that have recovered from COVID-19 and it's still in their system, and I know they have the antigens and whatnot, but is someone still contagious after the fact, even though they've passed it or they've recovered from the illness? Can they still be contagious?
Yeah, it's a really good question. As with, sort of many of the questions about how this virus actually acts within our bodies, we don't have a definitive answer, except all evidence indicates that on average, once you are asymptomatic, that your symptoms actually disappear after you've been sick, and you've been like 3 days without a fever, 3 days without any symptoms. We haven't heard of cases where people have transmitted after that. I think the area that it's going to be gray for a little bit is, what do we know about people who are asymptomatic, are positive, and never, ever develop any symptoms? Like, what's their clear date? And right now, there's really not ample evidence to suggest what that would be, although in general, our rule of thumb is, 7 days out from when you started, when you knew you were positive, you're generally not as infectious, not infectious at all if you had symptoms and the symptoms disappeared. But we're going to need more study about what's happening with asymptomatic people who never go on to develop symptoms, which is a small group of people. Some people are asymptomatic for a little while and then they get symptoms, but some people, it looks like they never, ever got sick. So we're going to have to see what that looks like. But thanks for that question. We'll take one more question.
And our last question comes from the line of Claudia Pesciuta with KNX Radio. Your line is open. Please go ahead.
Hi, Claudia.
Just want to confirm that there's a county probation officer who's tested positive, and see if there are any updated numbers for the Sheriff's Department and the Fire Department. Also wondering if you've gotten any clarification from the CDC on the team from Lancaster. And then, I'm hearing from a lot of people who are saying, somebody who worked in this building tested positive and we didn't find out for several days. And so, I'm wondering if there's any thought being given to doing a, possible exposure advisory as you do for measles, which I know is highly contagious and this is different. It's not the same thing, but still people seem to want to get that sort of advisory.
Sure. So for the teen from Lancaster, we're still waiting to hear back from the Centers for Disease Control. They're obviously doing some more extensive testing, so it might take a little bit. In terms of this last question about what do we, let me go to the earlier question about the numbers of people that are infected in different departments. You'd have to check with the sheriff and the fire department to get information about their numbers of their staff. I want to be honest, we have, as you know, thousands and thousands of cases now, and it's really hard for us to track everybody who's in different departments across the county family, but I know that there's particular attention that's being paid by both the fire department and the sheriff department, and would ask that you verify numbers with them. The same thing in terms of the person who works at the probation department. One thing I can say is whenever there's an exposure in a setting, I mean, so yes, there is a positive person, a staff person who works at probation. The only reason we've even been talking about it is that there might have been exposures to young people, and we're checking on whether or not there's any need for us to do more detailed investigations in any institutional settings. But in general, what we report on are institutional settings where there's been a risk, and not all the different people that at this point are positive for COVID-19. I do hear you about the request that would it be helpful to issue advisories in buildings where people worked or they frequented, and I know you've seen us do that a lot for measles. Measles is airborne, and we often can't trace close contacts, and that's why we do it. We've still really relied on identifying close contacts and making sure that close contacts are notified, and then taking action appropriate for those people who are close contacts, which, as you know, is that they need to be quarantined. It's very rare that an entire building, especially a building with many floors, that there were a lot of exposures on all the floors, so much so that everyone in the building is at risk. But I will take back to our team sort of this desire for people to have a better understanding of how they can protect themselves, because I think that's what's behind that, is if I don't know if I had an exposure, which I don't, and we keep saying there's no way to really know at this point, but if I don't know that I've had an exposure, then I'm sort of a little bit in the dark, and maybe I don't need to be so much in the dark. So I'll take that, we'll take that back to our team and see if there's a way to manage this a little bit better so that people have some reassurance. But thanks for the questions. We're going to close out the English part of the press briefing and move to the Spanish part of the press briefing. Thank you. To start? Okay. Buenas tardes a todos, y quiero dar las gracias a la supervisora Barger y a toda la Junta de las Supervisoras porque ellos están trabajando muy fuerte para todos nosotros y nosotros aquí estamos bien felices que tenemos estos líderes en el condado de Los Ángeles. También quiero agradecer a todos nuestros otros líderes por todo sitio en el condado, por todo el trabajo que están haciendo sobre la guerra sobre el COVID-19. Para reportar hoy sobre nuestro estado actual, estamos tristes de reportar de 11 muertes adicionales hoy. 9 de estas personas son mayores de 65 años. De los mayores de 65 años, 7 tienen problemas de salud subyacentes. Las otras 2 personas que murieron estaban entre las edades de 18 y 75 años. Y ellos también tenían condiciones de salud subyacentes. Esto eleva el número total de muertes a 65 en el condado de Los Ángeles. Y nuestra tasa de mortalidad para el COVID-19 es 1.8%. El 88% de las personas positivas para el COVID-19 que murieron tenían afecciones de salud subyacentes. Cada día informar estos números es devastador. Sabemos que al anunciar estas muertes hay familias y amigos que han sufrido una pena tremenda. Lo siento mucho y los mantenemos en nuestros pensamientos y oraciones. Hoy también estamos reportando 513 casos nuevos. En los últimos 48 años ha habido un 1,071 casos nuevos y el número total de casos en el condado de Los Ángeles ahora es 3,518. Estos casos incluyen 133 casos reportados por nuestros socios en la ciudad de Long Beach y 33 casos reportados por la ciudad de Pasadena. Estamos reportando también 5 casos confirmados entre personas sin hogar. El 79% de todos los casos positivos ocurrieron en personas entre las edades de 18 y 65 años. Este ha sido un número constante desde el principio. Por esa razón, todos debemos asumir que hay muchos más casos que están en todo el condado. 633 casos han sido en algún momento hospitalizados, el 21% de todos los casos positivos. 341 personas están hospitalizadas actualmente por COVID-19. Los 210 de estas personas tienen 55 años o más y 141 de estas personas tienen más de 65. Este demuestra que cualquier persona está en riesgo de contraer una enfermedad grave por el COVID-19, porque la mayoría de personas no son personas ancianos. El 20% de personas que están hospitalizados están en la unidad de cuidados intensivos. El 36% de los que están en la unidad de cuidados intensivos son mayores de 65 años y el 55% tienen condiciones de salud subyacentes. Hay 4 personas que tenían menos de 35 años que están en la unidad de cuidados intensivos. Puede ver el informe actualizado de los casos del condado de Los Ángeles en el sitio web del Departamento de Salud Pública. Y eso es en publichealth.lacounty.gov. También estamos investigando 43 entornos institucionales. Estos incluyen hogares de ancianos, centros de vida asistida, refugios, centros de tratamiento, viviendas de apoyo, cárceles y prisiones, donde hay al menos un caso confirmado de COVID-19. Y de las pruebas, en este momento hay más de 21,000 personas que han sido evaluados en el condado de Los Ángeles y 13% de ellos dieron positivos. Hemos visto grandes mayores de capacidad de prueba y esto es un testimonio del trabajo del doctor Kathryn del Departamento de Bomberos. Estamos muy agradecidos por todo lo que ha hecho para mejorar esto, pero todavía la capacidad sigue siendo limitada y a veces lleva todavía mucho tiempo obtener los resultados de las pruebas. Sigue siendo crucial priorizar a ciertas personas para las pruebas, aquellas con síntomas y que un proveedor ha determinado que son apropiados para las pruebas. También quiero decir las gracias a mucha gente en el condado de Los Ángeles, porque este tiempo ha sido bien difícil para tantas personas, pero hay muchas personas que están haciendo su parte para frenar la propagación del COVID-19. Quiero agradecerle a todos nuestros proveedores de atención médicos que están brillantemente al frente de esta pandemia, a nuestros trabajadores esenciales que mantienen las cosas funcionando y continúan brindando los servicios necesarios a nuestra comunidad. Mil gracias. A nuestros negocios, especialmente a nuestros propietarios y trabajadores de pequeñas empresas que están haciendo sacrificios para cumplir con nuestras pedidas y directivas. Muchas gracias. A los medios que informan con precisión la información crucial sobre el COVID-19. Muchas gracias. Y a cada uno de ustedes que están en la comunidad haciendo su parte para frenar la propagación, incluso cuando se siente inconveniente, extraño y a veces aterrador. Muchas gracias a todos. Ahora estamos abiertos para preguntas. We'll take some questions. Nope, there are no questions. Okay, thank you. Thank you, everyone. The briefing is over.